Hi, my name's Nancy. I'm a nurse practitioner student that's going to be doing your assessment today. This is Sam. She has agreed to be my patient for the day. I have asked her to empty her bladder, and we took her height, weight, and vital signs before we got started. We did the Snellen and eye chart for distance vision and the Romberg's for close vision, and all of those tests were normal. So let's get started today. The first thing I'm going to do is a facial and head examination. So if I could have you take off your glasses for me. Her head and face are normal cephalic. Her eyes are symmetric. Her nose is midline. Her ears line up with the outer canthus of her eyes. I'm going to touch your head now. Her hair is clean. It's a beautiful blue color. There's no lesions, masses, and her scalp is free of lesions. I'm going to touch your face. Have you had any tenderness or pain in your face, head, scalp, ears, anywhere? No. Okay. I'm just going to press on your facial bones and tell me if you feel any tenderness. No? No? Okay. I'm going to have you open and close your mouth, side to side. Very good. Did you feel any popping or clicking? Okay, I didn't either. Her temporomandibular joint is fluid and no popping or clicking. Very good. I'm going to palpate your sinuses now and let me know if there's any tenderness. This is your facial and maxillary and zygomatic. Any? No? Okay, any tenderness. Okay, very good. Next I'm going to do an eye exam. And normally here I would do a fundoscopic exam looking for the light reaction in her eyes and looking at the physiologic cup and the disc and looking for papilledema or edema of the vessels in her eye. Her eyes are symmetric. The hair on her eyebrows is it's coarse, but it's no spots, no empty spots. Her eyelashes curl upward. Her pupils are round. The sclera is white. Her irises are between green and hazel bilaterally. I'm going to, first of all, use a light and check your pupil. Okay, so look at my nose. There we go. Direct and consensual. Direct and consensual. What I'm doing there is just looking at each eye as I shine the light in it. It should constrict, as well as your other eye when I shine a light should constrict. And they did. Very good. I'm going to check your 6 cardinal fields of gaze. So I'm going to have you watch my finger and follow it with your eyes, but don't move your head. Very good. Her eyes are equal and react to light and accommodation. I didn't notice any strabismus. And now I'm going to do a visual fields test. And I'm going to do a whisper test while I'm back there, which tests some hearing. And we'll do your ears next, but as I come behind here. What I am going to do is move my fingers, and when you see them come into your line of vision, you let me know, okay? 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 Okay. All right. And now I'm going to whisper a couple of words, and I would like for you to repeat them back to me.
Flowers.
72.
72.
Okay, her whisper test, she passed very well. And actually, I'm going to have you take off your glasses again. I forgot to have you do the cover and uncover test, though. What I'm going to do is have you look at my nose, and then cover one eye, and then uncover, and cover the other eye, and uncover, And what I'm looking for there is the extraocular movement, which was negative. I didn't see any. Now I'm going to do your ears, and I'm going to look first, and I don't see any lesions or swelling, masses. Have you had any pain in your ears?
No.
Okay, I'm going to touch your ears. Any pain or inflammation?
Nope.
Tugging on them?
Nope.
Tug test is negative. I'm going to look inside your ear, and what I'm looking for is the tympanic membrane to make sure that it is without any tears or perforations. And have you look that way just a little bit. Her ear canal is pink. Her tympanic membrane is pearly gray. Light reaction is positive. I can see the bony structures, the bony landmarks. There is a little bit of cerumen. Got a little earwax in this ear. Pearly gray. Okay, everything looks the same bilateral. And your nose. I'm going to look at your nose now. It is midline. There's no deviation of the septum. The turbinates are clear of lesions or bleeding, and there's no tears. Can you occlude one side of your nose and take a deep breath in, and the other side? Another deep breath. Very good. Clear on both sides. So both nares are patent. I'm going to look at your throat here. Okay. I'm going to have you, okay, smile and frown. And scrunch up your forehead. And puff out your cheeks. Stick out your tongue. Can you put your tongue against my, and the other side? Very good. And can you shrug your shoulders? Very good. We're testing cranial nerves there. 5, 7, 9, and 11. Stick out your tongue. Very good. And all of her teeth are present and white. I don't see any dental caries. Her tongue is moist and pink. Lift your tongue up for me. Frenulum is present. There's no masses or lesions underneath there. Her hard and soft palate are pink. I'm going to say ah. And her uvula is midline and rises, as do the columns in her throat. I'm nervous, sorry. And now we're going to go on to the neck exam. I'm going to touch your neck. It's even, it's symmetrical. Musculature is normal. Her trachea is midline. Can I have you swallow? And I can feel her trachea as she swallows. I'm going to feel for any lymph nodes that are swollen. I'm going to do the occipital first. Okay. And the postauricular, preauricular, the tonsillar, the submental, and the cervical chain, and the posterior cervical chain, the deep clavicular. Let me have you turn your head that way a little bit. And the other way. And the clavicular. Very good. All right, and no nodes are present, no nodes are palpable, which is good. Can you tip your head to the side and to the other side and put your chin to your chest and look up? Very good. Can you turn your head to the left and then to the right? And her range of motion in her neck is normal. I'm going to go around behind you and do some work with your back, okay? Did I do the ears? forgot to do the Renee and Weber test, so I'm going to do that. So first the Renee test. It tests the sound conduction from the ear, the bone versus air conduction. And what I'm going to do is I'm going to hit the tuning fork and I'm going to set it behind your ear on the mastoid bone. And when you don't hear the sound anymore, raise your hand. And then I'll move it to the front of your ear. And when you don't hear the sound there, raise your hand again. Can you hear the sound?
Yes.
No? On the other side, can you hear the sound?
Yes.
And what we're testing here is the air conduction should be twice as long as the bone conduction on the hearing. Next, I'm going to do the Weber test, which is I strike the tuning fork and set it on the top of your head. And I would like you to tell me if you hear it more in your left ear, right ear, or equally in both ears, okay? Can you hear that?
Yes. Both ears.
Both ears the same. Okay, very good. Now I'm going to go around back and do your posterior chest. First, I'm just going to examine. Normally, the patient would have a gown on so I could really see the skin and the structures better. But since we are videoing it, I didn't want her to be uncovered. But her back is very straight. All the curvatures are present. The thoracic and the lumbar, the cervical, and then the skin is, she has a couple of papules back here, but no masses or lesions that are visible. Next, I'm going to listen for the sound of her chest, which should be tympanic, or which should be resonance, I'm sorry. And you would hear dullness over any masses or hard organs. And what I hear is resonance, which is a normal finding. I'm going to palpate her back and tell me if you feel any pain or tenderness anywhere.
No pain, no tenderness.
Okay. The costovertebral angle was non-tender. Now I'm going to percuss and find your diaphragmatic excursion, which means how far your lungs raise and fall with breathing. So first, what I'm going to have you do is take a deep breath in and hold it. And I'm going to percuss down and find the spot of dullness. There it is. Okay. And then I'm going to do the same on the other side. So take a deep breath in. Okay. Now, next I'm going to have you take a deep breath, blow it out, and hold it. And you're going to percuss up. Okay, and mark there. Go ahead and breathe. And do that again. Deep breath in, blow out, and hold. Okay, there we go. And I would mark that. And that is 3 or 4 centimeters, which is normal. I'm going to listen to the breath sounds in the back with the diaphragm of my stethoscope. Okay. Some deep breaths in and out through your mouth. Okay, very good. Thank you. Her posterior breath sounds and lateral breath sounds are normal with no adventitious sounds, no wheezing or crackles. Okay. Back around to the front. I'm going to look at her upper extremities. So if I could have you hold your arms out for me. Very good. I'm going to touch your arms. The musculature is symmetric. Very good. Her radial pulses are 2+, and her brachial pulses are also 2+. Her fingers are without clubbing, nodules, lesions, less than 3 seconds on her capillary refill, which is good. I'm just going to go ahead and test the reflexes while I'm here. So I will do the radial reflex. Very good. There we go. And test this one. Brachial. Very good. And your anterior chest. I don't see any lesions or masses swelling. Any tenderness in the front of your chest. Okay, I'm just going to palpate here. Any tenderness with palpation? Nope. Touching? Nope. Okay. And I'm going to have you say 99.
99.
Again?
99.
Tactile fremitus is positive and equal on both sides. I'm going to have just listen to your lungs first of all. Okay. Deep breaths in and out for me. Over here, lift your arm a little bit. Now, since I've got my stethoscope on here in the front, I'm going to feel and listen to her carotid pulses. I feel one side at a time because we don't want to block off her blood to her brain. And then, can you hold your breath for me? And I listen over her thyroid and her carotids. Go ahead and breathe. 4 bruits, which were negative. Now I'm going to listen to your heart sounds at the apical point. Am I boring you?
No.
Pulmonary. Erb's point. Mitral. I'm getting fresh here, sorry. And pulmonary. Aortic, sorry. S1 and S2 are heard in all fields. No gallops, clicks, or rubs. I'm going to have you swing your feet over here now. Thank you. I'm going to use this to maintain. And I'm going to do your abdominal assessment. Lift your shirt up here. Okay, first I'm just going to look, and what I see are some scars from an appendectomy, some light striae, no other scars or lesions. I'm going to have you lift your head up. We'll go ahead and lay back down. I was looking for umbilical hernias, which I don't see any. Her umbilicus is midline. Next I'm going to auscultate. Listen for bowel sounds in all quadrants. You can listen for up to 2 minutes for bowel sounds in each quadrant. And what you're looking for is hypo, hyper, or normal bowel sounds. You can listen for up to 5 minutes to find out before you can say that the bowel sounds are absent. her vowel sounds are present and active in all 4 quadrants. Now I'm going to listen to the abdominal aorta, looking for bruits, listening for bruits and adventitious sounds, and the renal arteries. And the iliac arteries. And the femoral arteries. And no bruise or swishing is heard. Next, I'm going to palpate your abdomen and touch it softly. And let me know if you feel any tenderness in any of the quadrants.
No tenderness.
No tenderness. I'm going to dig a little deeper here and see if you feel any tenderness.
No tenderness. Nope.
Oh, okay, very good. Now what I'm going to do is I'm going to find your the border of your liver. Okay, I'm going to percuss for that. Okay, it's right there. And okay, right there. And it's like 5 centimeters, so that is about normal. I'm going to have you roll over onto your right side, and I'm going to look for your percuss for splenic dullness. Okay. And splenic dullness is not heard. Go ahead and roll back over. Okay. I'm going to try and see if I can feel your kidneys today, capture one. So I'm going to have you take a deep breath in. Okay, now, nope, can't feel it on that side. And this side, deep breath in. And kidneys are non-palpable. Okay. Oh, and I forgot to percuss her abdomen for resonance. Tympany in her abdomen, sorry. And it is tympanic throughout. Okay, I'm going to look at your lower extremities first here. I'm going to touch your legs. The temperature, warm, dry. The skin is smooth and clear. The hair has a regular pattern. Test your pulses here. Your patellar pulse. Posterior tibial. And your pedal. They're all 2+. Her feet are the same color as her legs. Capillary refill is less than 3 seconds. If I can have you set up again. I'm going to test your reflexes here. First your tibial patellar reflex. Positive. That one's definitely positive. And your Achilles. Okay. There we go. All right. That concludes our assessment. Do you have any questions for me?
Nope.
Okay. Thank you so much.
Thank you.